Good afternoon. It's good to be here with all of you. Thank you so much, Anne, for inviting me back. It's been several years since I have been with these programs, perhaps in part because of COVID, but I'm glad we're sort of beyond COVID. So it is a pleasure to be here to talk to you about, we'll change things up, something non-medical, but all about affording the care that you need. And this is an issue that is very important to me personally. It's very important to the work at the PAN Foundation. The last thing people need to do when they are sick, when they're living with a serious illness, a chronic disease, a rare disease, is worry about how they're going to afford their care, and in particular, their prescription medications. Did you know that today 1 in 3 adults in this country walk away from the pharmacy counter without their prescription because they can't afford it? They can't afford the out-of-pocket costs. That's 1 in 3 people. Unacceptable. We know our healthcare system is a bit broken, but we do the best we can, and I'm really proud to work at the PAN Foundation because we are saving lives every day. Patient assistance can be confusing, and there's different programs out there. Part of the reason why people may be walking away from the counter is not only are their out-of-pocket costs high, but they may simply not know that there is financial assistance out there available to them. So you have great programs that are offered by the individual pharmaceutical companies. They help people who are uninsured. They help people who have commercial insurance by making sure that they can gain access to their branded medications, specific products. But what you may not know is that pharmaceutical companies can't provide financial assistance to people with federal insurance. So, for example, people on Medicare can't seek financial assistance from pharma companies, which is why charitable foundations like the PAN Foundation are so vitally important, because we are providing that important safety net for Medicare beneficiaries. Not exclusively, but many of the people that we help are on Medicare. So the PAN Foundation is one of what we call 9 charitable foundations who are in this business of providing assistance, financial assistance to cover out-of-pocket costs for medications. And we're usually the payer of last resort after Medicare picks up what they're going to pick up, or after your commercial insurance picks up the costs. 6 of the organizations are what we call independent charitable foundations like PAN, and the other 3 do a lot more. So, for example, many of you might have heard of the Leukemia and Lymphoma Society. They do a lot more. They do advocacy, they do research, but they also have a co-pay arm to their work. So we're a national patient assistance program. We are here to provide assistance to people who are underinsured, so you have to have insurance. And while we're providing this assistance, we are also strongly advocating for lowering costs and improving, making sure people have access to more affordable care. It's easier said than done. There's lots of barriers to accessing care in this country, but we try every single day to inch our way toward better care. We've been around since 2004. We've helped more than 1 million people afford their medications. We've provided, this is a really big number, more than $4 billion in financial assistance. And that's because there are a lot of people who need that care, and because many of these individuals are seriously ill, and they are on expensive medications that come with high out-of-pocket costs. So we're here to help these individuals. So we provide assistance in 3 areas. Today we're going to focus on the left, medication copays, but also I wanted to mention that people who are enrolled in our programs can also be eligible for transportation assistance. We give out grants for people because we know for many, transportation is an enormous barrier. So we want people to be able to get to their treatment center, get to their provider, get to a pharmacy. However, we also know that food is a big social driver of health, and too many households in this country are food insecure. So people can use this grant to go to the grocery store to make sure they have food on their table. They can go to a place if they want to exercise. We think all these social drivers of health play a real important role in improving one's health. So today we offer assistance in more than 70 different disease areas. They are chronic diseases, they are rare diseases, and they are for people living with cancer. And you see off to the right a whole list of our programs, probably, I think, up to 25 or so of our total programs are for people living with cancer. So one of those 70 programs is for people living with MPNs. And I'll go through the eligibility criteria. One is that you're being treated for this illness. You're receiving treatment and you reside in the United States or one of our territories. You have health insurance, so you don't have to be on Medicare. It's for anyone with insurance. You're prescribed a medication that is on what we call our formulary, our list of covered medications. On our website, we are very transparent. We have a list of all FDA-approved brand and generic medications. We also cover the medications that are included on compendia guidelines like NCCN. And you have income that falls at or below 500% of the federal poverty level. No one knows what that means, so I'll give you an example. So if you are, for example, a family of 2, and you have income at $91,000, you would fall into that yes category. 500% is about $91,500. If you meet all these eligibility criteria, you're eligible to receive a grant from the PAN Foundation, which would be $8,700 for assistance over a 12-month period. We design our grant amounts, and it varies from disease to disease, to cover the majority or all of out-of-pocket costs for someone. So our grant assistance is $8,700. For another program, it could be $1,500, it could be $10,000, because we know every disease is different in terms of the out-of-pocket costs that one might incur. So I just want to go over some terminology when you visit our website. Some programs are what we call open. That means they currently have funding in that program, and we are able to give out grants. Some programs are closed, meaning we have depleted funds. We're in the process of getting more funds into the program, hopefully soon. And when we do get those funds in, then we can open the program up to provide grants. While programs are closed, we encourage people to join our wait list, because when we're able to reopen the program, we're going to reopen it first to people on the wait list. Now, I hate to say this, but as of this morning, this program was closed. I think every single time I've talked at these programs, it has never been closed, okay? But hopefully it's closed for a temporary amount, and I encourage everyone to join the wait list if there is need. So applying is really easy. There's way too many barriers to accessing care, so we've made our application process easy, and it takes literally 5 to 10 minutes, either by calling us or going online. And within 5 to 10 minutes, one will know if they are approved or not. And if people are approved immediately, they can take their ID number, which they will get, right to the pharmacy counter and start benefiting from that grant. So first, obviously you want to know that the program is open and we can give out grants. So you can do that by visiting our website, panfoundation.org, or by calling us, number at the bottom, 866-316-7263. We want to make sure that you're going to meet eligibility guidelines. So You'll be asked questions if you go to the website, or if you call us, we have patient support specialists who will walk you through all these questions very easily. We have about 100 people in our call center ready to help patients and ready to help providers as well. Oftentimes the providers or individuals in the providers' offices are enrolling patients themselves. We'll gather some basic information from you to make sure that you're meeting the eligibility guidelines, and then, as I said, you'll be approved on the spot, or if you're not, it's likely because you haven't met one of our eligibility guidelines. So just a few reminders about our grants. This is a 12-month eligibility period. So if the program was open today and one applied and was approved for a grant today, it would extend for the next 12 months. We're not on a calendar year. We also have what's called a 3-month look-back period. So if you applied today and got approved and had incurred out-of-pocket costs for the past 3 months, we would cover those costs as well. We have what's called a grant use policy that basically just says we want to make sure that if we give a grant to an individual, they truly need it, they're using it. So if we find over a period of months that we're not receiving claims from you or from your provider, we'll reach out to you to see if there's a reason why, because we want to make sure that the grants are being used by the people with the most need. And then finally, there's always an opportunity to renew grants. We know people are living with chronic illnesses from one year to the next, so there's an opportunity to renew from one year to the next. I want to go over this important program that we developed 3 years ago. It's called FundFinder.org. I mentioned a few moments ago that there are 9 charitable foundations providing assistance. Can you imagine, as a patient, a provider, anyone trying to figure out who are all these organizations, who's offering what? Do I need to visit 9 organizations every single day to find out what availability there is? It becomes tiresome. And prior to 3 years ago, that's exactly what patients and providers did. But we brought everything together in a web app. So now the 200 plus programs that these 9 charitable foundations offer are brought together in one app, and one can very easily see which programs, and it's not just for MPN, it's across a multitude of disease areas, are open and closed. So anyone can register at fundfinder.org, and let's say you are interested in MPN. Here's the value of this app. Let's say all the programs offering, all the organizations offering MPN assistance were closed today, and you had registered for fundfinder.org, and tomorrow PAN opens. You would get a text or an email tomorrow saying PAN is open, and you would know right away, I better call or I better go online and apply right away to make sure I get assistance. So it is a true time saver, and I really encourage anyone living with a serious illness, providers, we even have organizations and they have call centers, and they're using FundFinder just to save time to find assistance for people. So I'm going to switch gears a little bit, and in the couple of minutes remaining, I just want to talk about advocacy, because this is also extremely important. It's not only important, as we have heard, to advocate for your own health care or to make sure you have an advocate to help you, but collectively, it's really important to advocate for legislative change that's going to improve access to care. And at PAN, we've spent a lot of time doing that, individually as an organization, but also collectively with other patient groups and coalitions. And we're very, very proud that, and pleased, that as part of the Inflation Reduction Act, which I'm sure all of you have heard about, that passed in August, there were some important reforms that will impact people on Medicare. And I just wanted to go over a couple of them because I think there's not enough news about some of them. You hear a lot about insulin, for example, which is really important, and actually that's one provision that's going to take place January 1st, meaning anyone with diabetes won't pay more than $35 a month for their insulin that's needed. This is in Medicare. That's a really important provision. Another important provision that takes place in just a month or so, January 1st, is no copays for vaccines. So there are some vaccines in the Medicare program, such as shingles, that can come with pretty high out-of-pocket costs. But come January 1st, there will not be any copays associated with shingles or other vaccines in the Medicare program. So those, I really wanted to bring that to your attention. I always like to talk about that, even if it's not directly related to the topic at hand. It's important to know. But what I want to really focus on are the efforts to lower out-of-pocket costs for people on Medicare, because it's really significant. And I'm going to go to this slide, which I know it's complicated, but I'm going to walk you through this. And what I want you to try to follow, but you won't have to do it so closely, is that circle on the left at the bottom, that blue color, is for enrollees. That's for someone on Medicare. So some of you may know that currently someone on Medicare will pay their deductible for their medications. Effective January 1st, that deductible is going to be $505. 2023 is going to look pretty similar to 2022. People will still, unfortunately, experience high out-of-pocket costs for some of their expensive medications. So once someone pays $505, they're going to pay 25% of the drug cost until they hit around $3,100. And that's when they get into what's called the catastrophic phase of their benefit. It's a terrible word, but that's what we use. And at that point, they pay 5% of the list price of the medication without any limit. That's been problematic. 5% sounds like a low number, but if you have a very expensive medication that you need, it's a big number. And so it's not uncommon for people on Medicare to have to pay $5,000, $10,000, even more out of pocket over a 12-month period. All that starts to change in 2024, and this was one of the Medicare reforms that was passed this summer. That 5% goes away in 2024. So in essence, and this is estimated by the Kaiser Family Foundation, in 2024, people on Medicare won't pay any more than around $3,200 for their out-of-pocket costs for medications. But even further good news is in 2025, when there will now be a hard cap of $2,000 for people on Medicare. So no one on Medicare will pay more than $2,000 for their prescription medications effective 2025. So that's great news for a lot of people. But we still know $2,000 is a lot of money for a lot of people. We know that, but it's a step in the right direction. And just before I go there, we did a recent national poll at the PAN Foundation to just kind of assess people's perspectives around this $2,000. And what we heard from adults is that 3 out of 4 would find it's still going to be difficult to pay $2,000. And the people who expressed the most difficulty or thought it would be most difficult were people with lower incomes, Black adults, Hispanic adults, and people living with chronic illness. So tremendous disparities in this country, which we know. Still have a lot of challenges, but these are good steps, and we were really pleased to see it. The final note on the Medicare reforms is this notion of smoothing, which is a concept that actually the PAN Foundation pioneered many, many years ago. As some of you may know, for people on Medicare, January can be a very difficult month. It's when deductibles reset, and it's often the time when thousands of dollars need to be spent. So for someone who may have $12,000 in out-of-pocket costs, today or in 2023, they may be spending $3,000 in January alone for their medication. and then, continued high amounts, maybe not that high, but still high in the remaining months. But in 2025, all Part D plans, and this includes the plans on Medicare Advantage, must offer enrollees the opportunity to evenly spread out these costs for the remainder of the plan year. They must offer the opportunity. It is voluntary right now, so we're trying to educate as many people as possible. What will that mean? It means that in 2025, remember there's a Part D cap. There's no longer $12,000 in out-of-pocket costs for this person. It's only $2,000. So if they opted in to smooth out these costs prior to the calendar year, prior to the plan year, look what happens. That $2,000 gets divided by 12 months, and it's $166 max per month that person will pay. That's a big improvement. If they start in the middle of the year, you can see the benefits of smoothing diminish a little bit, but it's still more affordable and more predictable for many. So this is another great Medicare reform. I think very few people know about it yet, and clearly it doesn't take effect until 2025. Truly wish that these provisions could take effect in January, but Congress doesn't act so quickly, so they need a little bit of time to kind of figure out how all this will operate. So I think that actually concludes my remarks.
I wanted you to just say,
Yep.
You did this at your last presentation, how many MPN patients?
Thank you. I thank you for reminding me, because I actually wrote that down because I wanted to raise that. So far, this year, we've helped more than 7,200 people afford their medications through the MPN program. And we know that the year is not over yet. I think last year we helped more than 8,000 patients. So there's a lot of individuals out there who need assistance for MPNs and for so many other illnesses. So we're glad to be here and help as many people as possible.